So people say that mental health is not really nursing. Mental health nurses get paid more than adult nursing. That's unfortunately not the case. Hey guys, welcome back to my channel. I hope you're all doing well. Thank you so much for joining me once again. My name is Bellinda, so if you haven't been joining me, please don't forget to comment, like and subscribe to this channel and join me on my nursing journey. So today I'm going to be doing a discussion basically on mental health nursing, adult nursing and also other fields of practice, but mainly those are the two fields of practice that I will be discussing in this video because I'm talking from my personal experience. Okay, so basically my first year of nursing, I started off as a mental health nursing student. Thereafter I asked for a transfer to adult nursing, also known as general nursing. So my first year, when I initially applied from college, from college going straight into university via UCAS, my personal statement was based on mental health nursing, and I initially did apply for mental health nursing. I'll do a separate video on my personal statement and how to write in a personal statement, how to get entry into university with nursing. I'll do a separate video for that. So today I'm going to be doing a discussion in regards to choosing the type of field of practice you're going to choose between adult nursing versus it's not really versus, there's 4 different types of nursing. So I'm just going to be discussing with you guys a few reasons as to why I did what I did. Okay, first things first, when you're going to apply for nursing school, you need to know which kind of nursing you guys are going to do. And we all know that in the UK there is 4 types of nursing. There is mainly adult nursing, mental health nursing, learning disability nursing and child nursing. Field of practice, many people don't really understand what mental health nursing is about. Many people that I know apply for mental health nursing because they've experienced it firsthand. Mental health nursing, I initially applied for mental health nursing because I'm from South Africa, and I feel like in Africa mental health issues are not really addressed in such, rather than addressing issues sort of as that this person, or acknowledging that this person has a mental health issue and they need psychiatric help. So for me, that was the reason why I went into mental health nursing. So anyway, I transferred over mental health nursing firstly because it wasn't really what I liked as such. So basically my clinical placements for the mental health nursing was like, I went to a psychiatric hospital, and I was working with I was based on a female ward, and the ward basically had different kinds of patients, from personality disorders to bipolar, schizophrenia. I also had a patient with schizophrenia, depression, as well as most of the female patients on that ward were self-harming in such, either cutting themselves, inserting batteries down below, in the genital area, ligatures, tying something around the neck and all of that. And to me it was really interesting because, to be honest with you, the difference what I've realized between mental health nursing and adult nursing is that with mental health nursing you really get that one-to-one basis with the patient. So if that's really what you into, then by all means mental health nursing is for you, because there's a lot of time to sit down with your patients and discuss really what the patient is going through. If they feel like they need to talk to you, there's really that sit down with the patient, even including them in the care planning of the patient. Like I said initially, I transferred over from mental health nursing to adult nursing mainly because I made research in regards to, migrating to another country. If the time comes for that, will I be able to migrate with my mental health nursing qualification that I obtained in the UK? And the answer to that question is no, because in other countries they do general nursing. So they do everything, you know. They include including midwifery, they include psychiatric nursing, they include mental health nursing, learning disability, they include child nursing. So they do everything in a whole. So that was my reason for it. To be honest with you, I didn't really feel like mental health nursing was for me. You do take the patient's observations and you do medication as well as a nurse. I feel like with mental health nursing, it is mainly care planning, sitting down with the patient, you know, helping them with a period of treatment, you know, helping them with rehabilitation if that comes to that in regards to, you know, mental health. You know, it varies from ward to ward. The thing what I realized with mental health nursing is that the patients are there for a very long time. If they are sectioned and they are not getting any better, you know, they are really placed there. So I feel like you really have that time to form one-to-one nurse-patient relationship, because the patient gets to know you better and you as a nurse get to know the patient better. Whereas with adult nursing or general nursing, you know, it's in, out, in, out, in, out. That's the way I have experienced it. So basically, I went to a general hospital, a surgical ward, and there was a really, I tell you what, I thoroughly enjoyed it. It was amazing, because it was more like, you know, you get to know the various types of medication. I'm not saying in mental health nursing you don't get to know the medication, but with adult nursing, general nursing, you get to know more medication. You get to do the IV. It's highly unlikely that as a mental health nurse you're going to be doing IV. You may do it, but you are not really trained to do it. You have to do another special training for that, to do, you know, to give out IV medication. I got to do things like NG feeds, you know, how to cannulate a patient. So in a way, you know, mental health nursing and adult nursing relate, because there is no health without mental health, whereas adult nursing is more broad. You understand? You can go into different aspects of adult nursing. You know, you can work in an acute medicine ward, you can work in a surgical ward, oncology ward, you know, ENT ward, you know, A&E. You know, you can work in so many different places or fields in adult nursing. Small, tiny, you know, like adult nursing is the branch, is the tree, and then you've got your different branches going out into. And I feel like for me, if I was gonna choose, as young as I am, and I was gonna choose nursing as a long-term career, I was gonna want to have change, some sort of another. And for me, if that change would be working in different specialized fields, you know. Secondly, I chose nursing because I feel like it's more fast-paced, and that's the kind of person that I am. You know, I feel like you also need to know your individual self. I'm more of a, you know, get in there, do what I need to do, and, you know, get on with it, you know. Whereas with mental health nursing, you've got to have a lot of patience. You understand? So that is just my personal experience. I'm not saying you don't have to have patience when you're doing adult nursing, but with mental health nursing, you've got to have a different kind of approach and a different kind of patience, you know, and you need to be mentally healthy, if that makes any sense. With mental health nursing, in regards to study, the study was different. We learned about the anatomy and pathophysiology of the human body, but we just did a quick brief over it. Mostly it's about the different mental health issues that people face, whereas in adult nursing we are really taking into consideration the full pathophysiology and anatomy of a person, you know, and really discussing it in depth. Yeah, for me personally, I feel like there is more opportunity in adult nursing rather than mental health nursing. Like I said, mental health nursing is a specialized field, so, you know, if you want to go into that, you can do that. That's up to you. That's a personal preference. At the end of the day, I'm not saying that when you do mental health nursing you can't top up. You have the opportunity to top up. You've got the opportunity to do a dual registration as well, if you know what it is. So you can go into those, you know, aspects. Obviously, dual registration, you've got to study an additional 1 year more. So you're basically studying for 4 years rather than for 3 years. So that's what you've got to look into. Okay, and so my advice to anybody who's going into, you know, nursing, just take some time and look and think, really, you know, do some research on the different fields of practice, which will help you to decide what kind of field of practice. Because I didn't do any research, and I'm going to be honest with you guys, when I went into mental health nursing, I didn't do any research about it. I just said, you know what, I want to go into mental health nursing, boom, and this is my reason for it. Do you understand? I didn't think about what if like this, what if long term, how am I going to be there long term, how is my personality or myself going to be able to, you know, how am I going to be able to integrate my personality into mental health nursing, you know, what is it going to be like. To be honest with you, I think I'm lucky enough to have gained that sort of 1 year experience to know what it is about. I was lucky enough to be transferred. I know sometimes students are not lucky, the university doesn't allow you to transfer. When you transfer, you've got to go and write another statement, and then you've got to go and do like sort of another mini interview, not a major interview like the first time, but just another mini interview. And then they will decide in accordance to your interview, in accordance to your knowledge, as well in accordance to the marks that you have achieved so far, whether you will be able to, you know, move over and handle adult nursing. I've also recently joined this started following this nursing group on Twitter, and there's some, you know, discussions about people getting a bit slightly confused that mental health nurses get paid more than adult nursing. That's unfortunately not the case. When you qualify as a nurse, whether you mental health nursing, adult nursing, learning disability nursing, child nursing, you all get the minimum wage of a newly qualified nurse. So if you're going into mental health nursing thinking, wow, I'm gonna get more money in mental health nursing, you're going into it with the wrong frame of mind. And also I've heard when I was doing mental health nursing, I've heard people you know, a group of people talking, oh no, I don't want to do adult nursing. When you do adult nursing, all you've got to do is toileting, personal care, washing, and I'm so tired of doing things like that. All I want to do is just give out medication. It's not about that, you understand what I'm saying? So whether you do mental health nursing, child nursing, learning disability nursing, it doesn't matter. Somewhere along the line, you're gonna need to help a person who needs assistance with personal care, or who needs assistance with a continence aid. At the end of the day, that is what nursing is about, that one-to-one interaction with a patient, and that's basically the foundation of nursing. If you wanted to just give out medication all day long, then you should have just gone to medical school and stayed in medical school. Okay, as I was discussing earlier on, some mental health nurses will take blood, some mental health nurses won't take blood. It all depends, you know. It depends what unit or what department rather you're working in. I don't want anybody to think that I'm pro mental health nursing, because I'm not. But for my own personal reason, I just chose adult nursing for myself because of the wider spread of opportunities there is. And then lastly, I just want to discuss that, you know, immaterial of what kind of nursing you choose, there will always be a job waiting for you. So many people think that, oh, it's going to be harder for either, you know, to get a job in a mental health nurse or in mental health nurse sector. That's unfortunately not the case, because there is a great need for mental health nurses in the UK. So 100% guaranteed is when you finish your university studies, there will definitely be a job waiting for you. And the same applies with adult nursing and mental health nursing, child nursing and learning disability nursing. Nursing is nursing. We have chosen a great career to go into, because we will never sit at home jobless. Okay guys, so please guys, if you like this kind of videos, please don't forget to comment, like and subscribe, and I will hopefully see you guys in my next video. Bye.